Welcome back. In this video we'll listen to aortic stenosis, we'll know the symptoms, the causes, and the treatment. It's a systolic crescendo-decrescendo murmur. So it's systolic, which means that it's between the first and second heart sounds. Crescendo-decrescendo, so it's increasing then decreasing, with a peak in the middle. To better appreciate the murmur, place the stethoscope in the second right intercostal space. And here's what it sounds like. The most common cause is age-related calcification. Other causes include congenital heart diseases, previous infections like infective endocarditis, chronic kidney disease, and history of radiation therapy in the chest. The most striking feature in presentation is syncope. This scenario would present a patient who was doing exercises, then he suddenly faints. Angina-like presentation is also very common, where the patient would have heavy chest pain when doing exercises, and it is caused by the heart pressing against a narrow outlet, which causes colic-like heart pain. And the syncope is simply due to insufficient blood reaching the carotid arteries. As with all cardiac murmurs, transthoracic echo is the initial test, transesophageal echo is better, and catheterization is the most accurate test. 1% of the population have a bicuspid aortic valve, which causes narrowing of the outlet. This presents exactly like aortic stenosis. For those patients, simply do echo every other year, and once the patient reaches the age of 30, do valve replacement, or if they have cardiac symptoms before reaching the age of 30. The treatment is simply valve replacement. To make memorizing heart sounds easier, I've designed an app called Heart Sounds. The app includes the murmur explained in this video, along with every other murmur. You can browse them very easily, compare them together, listen to them, know the causes, the symptoms, and everything else. And as a cherry on top, there is even a quiz section that you can use to test your retention and make sure you stay updated. It is completely free in the Play Store. I'll have the link in the description.